I'd like to turn it over to Staff Sergeant Amy Hachborn. Staff Sergeant Hachborn's been a police officer with the Waterloo Regional Police Service for the past 20 years. Currently, she is the Staff Sergeant of the Intimate Partner Violence Unit, which is comprised of 20 investigators, 2 sergeants, and detectives assigned to focus on early intervention and high-risk offenders. And I guess there's no greater indicator of how serious this issue is in a community than the fact that there's a full investigative unit within our Waterloo Regional Police Services dedicated to this issue. So, Staff Sergeant Hachborn, thanks for being with us tonight, and I'll turn it over to you.
Thank you, Rob. Thanks for inviting me to be a part of this. I'm going to start my timer as well. I was speaking with the KW Zonta Women's Group last night, and I was supposed to speak for 30 minutes, and I looked down at my watch and it had been 55. So it's a topic that I'm very comfortable talking about, and sometimes I can be a little long-winded. I just wanted to start by talking a little bit about where we're located, because I think it's a big part about our success. So we are located in the Camino Health and Wellbeing Building on Queen Street South. It's the Intimate Partner Violence branch, our early intervention branch, and our youth protection branch is also located there. It's not a police building. We're the only branches that are not located in police buildings. And I think it's a very comfortable, neutral location for victims to come in and speak with police. As some of the other speakers have talked about, we're co-located with other members of the Family Violence Project, and we work together to provide victims wraparound support, counseling, safety planning, information on emergency shelter, and then also our youth protection branch works hand in hand with Child Witness and their advocates, because a lot of kids are obviously witnesses to what goes on in their home, and so that is a partnership that we're very proud of as well. We've been here since 2006, and we're super proud to be a part of this group. We are one of the busiest branches in the Waterloo Regional Police Service. On average, we are laying over 3,500 charges a year, and that's about 1/4 of the total charges for the entire police service. So anyone who applies to work for the Intimate Partner Violence branch comes in knowing that they will be working very hard, and they definitely earn their keep here. Intimate partner violence is an area that the Waterloo Regional Police Service is focused on investing in. So Rob talked about how we have 20 investigators on the floor that investigate intimate partner violence occurrences. And then for 2024, we'll be adding 4 new investigators. So because of the workload, the service recognizes the need to grow. It's exciting for our officers who are working here, as we're going to be able to kind of balance their workloads a little bit better and become more manageable. It's also exciting for the victims that we deal with, because we're going to be able to provide better customer service to them. I want to talk a little bit about our early intervention branch. Currently, we have 3 members who are a part of early intervention and our high risk area. And WRPS is investing in preventative initiatives to try and intervene before criminal offenses take place. So beginning in June 2022, we started a pilot project with Women's Crisis Services of Waterloo Region. And that pilot project involved a detective being paired with an outreach worker. Each day when the detective came into work, they would review all the calls for service, all the intimate partner violence calls. And what they were looking for was 3 calls for service for intimate partner violence incidences between a couple over a 3-month span. And these are non-criminal incidences. So these are not calls where people are getting arrested or where criminal charges are happening. These are non-criminal incidences, but sometimes things tend to get worse as they go along, especially as Sarah mentioned, when there's this pending separation. So the goal here was to intervene before we got to criminal activity. So the outreach worker and the detective would meet weekly. They would contact the couples by phone. The police would educate about what happens when charges are laid. The outreach worker would provide and offer supports. And then they also had discussions about the root causes of what was causing intimate partner violence or arguments in their relationship. If the officer and the outreach worker were unable to reach the couple by phone, then they would we'd assign someone to go out with the outreach worker from our office on foot, and we'd go and knock on doors. So we're really doing everything we can to connect with these couples and offer our assistance. The feedback from the couples who participated has been really positive. And then in January of 2023, we changed the criteria from 3 incidences in 3 months to 2 incidences in 2 months, because we felt we had the capacity to reach more people. And the result at the end of the pilot was a reduction in calls for service from these couples, a reduction in the charges laid for couples who participated in early intervention, and overall satisfaction from those involved in an early intervention. So currently, the spot filled by the detective is a temporary accommodated position. So at this point, we're going to be asking for this to be made a permanent position sometime in 2024, because we just saw such value in this program. Looking forward to the future, obviously, there's never any shortage of work. And obviously, we are big on risk management. I can tell you that today, most of my day was spent trying to manage some risk from an incident that was happening in town. But we also are shifting our focus as much as we can to providing education, because the more the community understands about intimate partner violence, the more that we can help each other, the more the community can help, the more our neighbors can look out for us, our friends, and when they know what they're looking for, we can hopefully intervene before things become criminal.
So Amy, is it okay if I call you Amy?
Of course, yes.
Staff
Please.
sergeant's a lot, but anyways, thank you. I like the preventative concept, and I was just wondering, it's an officer and a outreach worker together. What is the what is the do they provide other services or access to services or make recommendations to services?
Yeah, so the police part of it is the education part, because I think a lot of people, especially young people, don't really understand what could happen if things get to the point of criminal charges. If a criminal charge is laid, it involves an arrest. It may mean being held in custody overnight or for a period of time. It could mean a release document, which always has conditions on it, which can affect where you live and who you're allowed to contact. So the police provide information about that part. And then from Women's Crisis Services, from Jen's team, they talk about what services are available, whether it's counseling, whether it's emergency shelter, safety planning. I think what happens is they discuss with the couple and kind of get a sense of what sort of things they might need, and then make recommendations based on their conversations.
And just to touch base on a question from Charlotte Hendricks earlier about, do reported femicide cases end in murder charges? Are you able to comment on that?
I can. So if the offender is still alive, then they would most certainly be charged with murder. A lot of times what we see is that the offender takes their own life, but certainly if the offender is still alive, then yes, there would be homicide charges laid by the police.
Okay. All right. Well, Amy, thank you very much for your information, and there'll probably be some more questions later on. I won't comment on Christmas decorations before December 1st, but anyway, thank you very much for that.